All right. So we are live. All right. So hello everyone. So NEET SS 2023 exam is over. The exam was yesterday, and we have already conducted a few recall sessions. The remaining subject recall sessions will also be scheduled very soon. So all our faculties at Doc Tutorials, we were collecting the questions from the candidates who appeared for the exam, and mixed type of reaction from various students after the exam in terms of the difficulty level. So we had so many queries from students. Sir, what do you think will be the cutoff? How do you assess the difficulty level? Was it similar to last year? So many such questions. And some students are also in the process of recollecting. Obviously, when you are done with the exams, you might tend to forget certain questions, understandable. So we have decided to do this session for you. Myself, Dr. Rahul Rajeev, faculty at Doc Tutorials. And also with me, I have got Dr. Karthik, DM Endocrinology, faculty at Doc Tutorials, and student favorite faculty as well. So see, both of us have come here, and we'll be just brushing through the entire paper and also giving you certain insights on the difficulty level, the sources from which the questions have been asked. So Dr. Karthik, welcome to this session. And I think, you can start from here.
Yeah, thank you, Rahul, sir. And hi and warm welcome to all the students who have joined for this live session. So first of all, I would like to emphasize one thing, that all the faculties will be doing their individual recall session of their respective specialties. This is primarily not a recall session, and here we will be doing the overall paper analysis. Okay, so I'll start sharing my screen. So I hope the screen is visible now.
Yes, you can make it visible.
Yeah, okay. So the points or the main agenda of today's discussion is to have an overall assessment of the difficulty of the questions, or how easy or how difficult was the paper as a whole. Then what was the specialty wise question distribution? Which specialty contributed to the maximum number of questions and which were lesser important? Such assessment. Then to identify certain high yield areas from each specialty, not only for those who have appeared for the exam, but very, very important for those who are going to appear in the coming years, because identifying those crux areas will pave the way for better preparation in the coming years. Then a discussion regarding the question pattern, whether it is similar to the previous year question or there was a drastic difference in the question pattern. And finally, the main question of the hour, whether the reading Harrison alone is enough for a good rank in NEET assess, or how many questions were directly or indirectly from the Harrison medicine itself. So here I've done a preliminary assessment and I've gone through all the 150 questions, recall questions, which I could gather from the students. And me and Rahul sir will be discussing for the next 30 minutes regarding all these points. So first of all, regarding the difficulty level of the questions. So according to our assessment, so this paper has shown the standard difficulty pattern of an NBE exam. For every exam for that matter, there would be a proportionate share of easy or straightforward question, to questions with moderate difficulty, and questions that are really tough. Those who are having even very good preparation will find it difficult to answer. So we have found out that this exam has also shown that same pattern of difficulty, where around 50% would be very, even those with superficial reading, or we can say like NEET PG like difficulty level questions, where therefore 40 to 50% questions, moderate difficulty around 30%. That means you will be familiar with the subject, you might be able to narrow it down to 2 options, but there you will have a difficulty. Those are those questions with moderate difficulty, and remaining 20 questions, 20% of questions, those were really tough. So even those who have read Harrison multiple times and revised would have found it difficult answering those questions. So Rahul sir, so you have done the reviews of NEET SS papers for so many years now. So how do you assess or the difficulty of this year compared to previous year and the years before that?
Dr. Karthik, even yesterday, many students had asked me regarding what is my assessment of the difficulty level. So I told them that also, that just wait for one more day, because for every question paper, once you come and start discussing with the candidates, initially the recalls will be partial or incomplete. So certain questions which apparently might look simple might be a bit twisted. But I think, I totally agree with what you have projected. So this was not a very tough paper, not a very easy paper, as you said, a typical NB type of paper, which in a way is good, because for the candidates who have sincerely prepared, like putting time and effort for this, I think they'll be benefited, because the 30% that you have shown in the moderate difficulty and the 20%, that will definitely be rank deciding. But sometimes what can happen is, if the paper is very easy, sometimes it might not be an advantage for students who have genuinely prepared. But for those who have read Harrison well, those who have worked the MCQs out, I think, this was reasonably an okayish paper.
And Rahul sir, one more point I have noticed when comparing the options as well, not only the questions, but the options as well from this year compared to last year. So I often believe that it is not only the question, but also the options that are given, which determines the difficulty of the question. Last year, many questions which will appear difficult, for example, some rare genetic syndrome, but when you go through that option, you can easily rule out certain options. Why? Because those were familiar things, you will be knowing about them. So even if you didn't know the exact answer, you were able to rule out that. But here I could find a whole lot of number of questions where there are two very close options, where even after I've gone through the Harrison, I've gone through certain guidelines, and still I'm confused on what is the final answer. So I think if you compare with that of the previous year, of course they are comparable, but this year would be slightly tougher, mainly because of the closeness of the options. I hope you will agree, Rahul sir.
Absolutely right. Even yesterday also, we have to do a few references as well from textbooks for certain questions. So, candidates need not worry regarding that. It happens for certain questions. It is very actually controversial as well. Right.
Okay. So we'll be moving on to next very important segment, the specialty wise distribution. I for the last few years I've heard students saying after the exam, so here this exam cardiology fared the most, or the maximum questions came from nephrology or neurology or endocrine likewise. But again, this when you go through the specialty wise distribution this year, you will be quite surprised if you already had the specialty wise distribution questions of the last year. So out of the 150 questions, so this is what I could garner from the recall. Again, this is not 100% accurate. Why? Because there would be significant overlap. For example, a patient, when the question was regarding hepatitis C and the drug used, it could be considered either under infectious disease or under gastro. For example, Clostridium difficile, it could be classified as either gastro or ID. So some degree of overlap will be there. But considering all that and equally distributing the questions among these specialties, so these were the order in which the number of questions had come. The neurology, the gastroenterology, and endocrinology had questions more than 20 in number. And if you combine the nutrition, so this is actually one surprise element, because the nutrition had 5 or 6 questions this year, whereas last year only one question had come from nutrition. And so as genetics, if you can see at the bottom, you can see that 5 questions had come from genetics. Last year also 6 questions came from genetics, but compared to last year, where rare syndromes and sometimes unknown syndromes were asked, this year the questions were relatively straightforward regarding the inheritance, and most of the questions that you are already heard of and are well described in Harrison as well. So three specialties had crossed that 20 question barrier. And another surprise, not surprise, actually one change which I have observed compared to the previous years is the increased number of questions from hematology. Last year, hematology had a very few number of questions, and this year hematology had 15 questions, and we will be further highlighting from what all sub areas these questions had come from each specialty. And regarding respiratory medicine also, we have, compared with oncology, you have 10 questions, out of which 6 or 7 questions were from respiratory medicine alone, whereas compared to last year, only 2 questions were from respiratory medicine. Rahul sir, what is your take from this ever-changing specialty-wise distribution of the questions? What message should students infer from this?
Yeah, so as they always say, change is the only constant. So if you remember last time when we did the recall sessions as well, at that time, if you remember, cardiology had slightly more weightage in the previous paper. So slightly it has come down, but yes, there are questions. So what it actually shows is you cannot go to the exam hall with a prefixed pattern. We already know certain topics like neuro, gastro, cardio, hemat, endocrine. These are all important. Hemat, in fact, had lesser number of questions last time. But again, you cannot form a fixed pattern. But I agree on one aspect that last time also the genetics was a surprise element to the students because nobody had expected those many number of questions last exam pattern. So this time, I think students had specifically prepared for that, the genetics part. So I think, that became a bit easier. And also regarding statistics, Karthik, we had done a session by Dr. Rajeev madam, our PSM faculty. So she was kind enough to do a session, especially for the NEET SS aspirants. This was available in the app as well on biostatistics. And see, the questions are 4 in number. And sometimes what can happen is these questions can also be rank deciding, because during residency, sometimes you can be a bit out of touch about biostatistics. So suddenly when you get questions, you might just wonder, what is the answer? So overall, my take is pretty balanced. A few surprises, like as you said, compared to last year, hematology having slightly more representation, cardiology slightly less. I think there was no ECG question as well. And again, genetics maintaining that level, and also statistics, also few questions. Yeah.
Okay. Now we will move on to each specialty wise. So first, about neurology, I will not be discussing the individual questions that had come in neurology, but just to highlight which were the high yield areas from where the questions were asked. When you look at the drugs in neurology and allied areas, there were 8 questions with regards to mainly about the adverse effects. So that again points towards a very important area. This year, this could be a neurology-based drugs adverse effects. The next year, it could be cardiology, hematology, or even endocrinology. But again, that emphasizes the importance on learning about drugs before appearing for NEET SS. Then some physiological aspects.
Just to interrupt there, we had done a session at Doc Tutorials 1 month before the exam, just to highlight on the most high yield areas. And in that video also, I have specifically made a mention, please do not neglect the drugs part, especially anti-epileptics. We have learned all this in our say MBBS days. We have studied it for NEET PG, but the questions of the anti-epileptics that were asked were at NEET PG level. What is causing glaucoma? What are the ones causing weight loss? But obviously a few surprises, like, obviously a few controversial questions also, like migraine prophylaxis in lactation. Yes, you can have verapamil, which is relatively safe in lactation. But again, if you look, amitriptyline is a drug which has reasonably good efficacy and also is safe in lactation. So, as always in any exam, there are certain questions for which, you can always argue on both sides. So there are a few questions like that. But overall, a very important point, a neglected area is often regarding drugs, Dr. Karthik. I think this is one message we should convey to them. Please do learn about the drugs part as well.
So we had 3 questions from the physiology aspect, and I think the answer for the pain perception and the placebo effect is still controversial, and that exact statement that conveys the answer is not there in Harrison as well. Then 2 questions from epilepsy, 2 questions from movement disorders, then element disorders we had 3 questions, and miscellaneous we had 3, combining to a total of 21. So other than drugs, it is reasonably equitably distributed across all sub areas in neurology. And coming to gastroenterology, Just like we had highlighted the drugs which came as a surprise in neurology, it was the images part. So the images contributed to around 8 questions. When I talked with the students, they have given me a feedback that there were around 20 to 30 images in total for the exam out of the 150 questions. And of these, 8 of them came from gastroenterology. That again is a bit of a highlight. And most of these images were taken directly from the Schlesinger textbook of gastroenterology. So that could be one of the things that you can look forward in the future, where may have to just go through the images of the specialty textbook as well. The similar thing happened with the pruning question with the cardiology paper as well, where the exact image was taken from the Braunwald textbook of cardiology. Apart from that, the other remaining questions were equally distributed among gut, liver, and viral hepatitis. Of course, there were so many even though the questions may appear relatively straightforward, there were so many confusing options. As I've already told, that could be a trickier part that would make this paper a bit more tougher. That means the moderate level questions may rise from 30 to 40% if the students doesn't have enough solid knowledge to differentiate between the final 2 options. So highlight about gastroenterology is the images, number of images that has come up. And again, that is a take-home point.
Some of the questions, slightly at a higher plane. So I think, a few rank deciding questions might come in gastro and hepato here.
Yeah. Okay. So coming to endocrinology, we had a detailed assessment on the endocrine paper last day. So again, there were no questions from the pituitary section, but as I've always keep telling, bone mineral metabolism is a very high yield area in endocrinology, and it has contributed to 4 questions in bone mineral metabolism. Then again, diabetes, 4 questions. Pediatric endocrinology had 3 questions. Obesity and lipid metabolism, 3 questions. So other than that, the pituitary being left out, all other areas were almost equally covered. And apart from bone mineral metabolism and diabetes, I couldn't stress off one area where most of the questions were being asked. I'm not going into much of the details because we already had a detailed discussion.
I think, just one point here.
Yeah.
Even there was a question that was repeated from the previous paper on the, the anti-aging part. So I think it is worth to go through the previous year discussions as well, right? There may not be so many exact recalls, but you never know. You have to go through the previous year recall videos as well. It is there available in the YouTube as well, in the Doc Tutorial SS YouTube channel, the last year recall videos as well. Yeah.
Yes, sir. The SGLT2 inhibitor question, as well as the hypercalcemia question, even though question was not exactly the same, but the crux of the question was same, even for the question that came last year also. That again emphasizes the need for going through the previous year papers, at least 2 years prior to your current exam. Now, one thing that has contributed so much is the nutritional disorders. I've told you that only 1 question had come last year, but here that small section in Harrison has contributed to as much as 5 questions. And some of them were confusing also, like the vitamin E toxicity causing bleeding diathesis in those taking warfarin, and the heart failure and refeeding syndrome. We have discussed the controversy around that question yesterday also. So those 2 were the controversial questions from nutritional disorders, and other 3 were pretty straightforward. That again, these areas in Harrison, even though they cover less number of pages, even though they have less amount of content, they could still contribute to similar to a major specialty. Okay, so that is the importance of covering these nutritional disorders and critical care, toxicology, etc. Now, coming to hematology, just like I've already mentioned, compared to last year, we had almost 2 to 3 times more number of questions, and questions were, as expected, were distributed across the leukemia, lymphoma part, the RBC disorders. 2 or 3 questions from multiple myeloma were there, and some miscellaneous questions with regards to the thrombosis and all. Sir, Rahul sir, any take on the hematology, the increase in?
It was actually a surprise to see more number of questions from the hematology part, because last time we thought it would come, but lesser number of questions. But this time, and I think many of them were expected type of questions, and much of it has been covered in the revision videos as well. I saw a few students commenting as well. So overall, decent questions from hematology.
Yeah. So infectious diseases, I am not going much because we had just finished that recall session from Nia sir. Sir has discussed 18 questions. Here I have included around 14 or 15, mainly because of the overlap between other specialties. So these questions had come from the areas where we have expected, except 2 or 3 conditions like the Pontiac fever, where they are asking it for the first time, and there were no questions from tuberculosis as well. One question had come which had a controversial options as well. A patient with TB sequelae, which is the diagnosis where bronchiectasis or lung abscess again, but Sarah has discussed about that. So coming to cardiology, so one thing which I've noted about cardiology is that the last year there were around 22 questions from cardiology, but around 70 to 75% were on the like easy to moderate level. But this year, even though the number of cardiology questions have reduced, but the questions, the level of toughness were actually higher. In fact, I found that most of the controversial or difficult to answer questions were there from cardiology. Some of them were actually there in Harrison, but even on one-time reading, you are so prone to miss those points. So that's what make cardiology, I think, one of the most toughest area in this NEET SS paper. And we had questions from valve disorders, disease of vasculature, as well as cardiomyopathy. So Rahul sir, how do you think we should prepare for one specialty, whether you should prepare for even the most toughest paper, or you should cover an equitable proportion of questions with all difficulties?
Karthik, I think for every session that I've conducted in doc tutorials for the SS orientation or preparation strategies, I've always made a point that the exam pattern is very unpredictable. So I have seen papers where it is more factual, paper where it is more clinical, and a mix of this, just like this one. You've got a mix of questions. Now, I personally feel that for preparing for such a competitive exam, prepare for both ends. Obviously, you cannot go to the super specialty textbooks of everything, but I think you have to raise your bar and prepare in such a way that you are prepared for whatever level of toughness comes your way. I'll tell you what happens. Sometimes if you practice only very long clinical scenarios and you go to the exam hall, and just like last year in cardiology, some simple questions on second heart sound, some simple questions on JVP, and if you get that wrong, your rank gets affected. So I think, you have to strike a chord and strike a balance while you prepare for a subject. That is why you have got to understand, what is your current level of preparation, and accordingly, you have got to prepare for each specialty.
Okay. Good point, sir. So again, coming to rheumatology, we had around 9 questions, all from expected areas, and most of the questions were there from Harrison itself. So all these, the osteoarthritis, the most potent risk factors, the storiform fibrosis, the straight back syndrome, Behçet's disease, everything were straight picks from Harrison. Just they are taken the lines of Harrison and has put as the question. And one controversial question, not controversial, one point which was not given in Harrison was the condition with specifically cuticular telangiectasia. But again, both SLE as well as scleroderma were mentioned to have cuticular telangiectasia, but not as a specific feature in Harrison. So I'm going with SLE as the answer for that question, which so many students have brought us as a query. So all the others were pretty straightforward as far as rheumatology questions are concerned. And rheumatology also had a more number of questions compared to last year. Last year, there were around 4 questions. Now we have 9 questions in rheumatology.
And some of the questions, direct handpicked from Harrison as well, like, osteoarthritis, most potent risk factor. So we'll be just discussing that as well, what percentage of questions came from Harrison soon in the later part of the discussion. But if you look overall, the topics, SLE, Behçet's disease, dermatomyositis, Sjogren's syndrome, so IgG4 disease, the topics are important. Only thing is that the depth of questions, can actually vary. Okay, so one advice I want to tell everyone is, I agree that there were definitely tough questions in this exam, no doubt about it. Some of them, at a very high level. But see, if you look at the majority of the paper, the topics are all from important areas. So, and it's just like Karthik said, it's how you prepare for those topics which will determine your rank in this exam.
So moving on to the next area, nephrology. Nephrology had a slightly lesser number of questions compared to last year. And of course, there were few questions which were overlapping with the rheumatology and endocrinology as well. And there were no real surprises as far as the questions were concerned. And one slightly doubtful question, I think the recall question was not complete regarding a patient with a gross proteinuria and uveitis, whether it is spondyloarthritis. So that was only the controversial question I could see from nephrology. All the others were reasonably straightforward. And one question was straight from the physiology, where the CSF concentration of bicarbonate is higher than that in plasma, but that too is given in Harrison. So apart from one question, I think reasonably straightforward questions from nephrology.
Right. And I think all important topics as well, right? Expected topic areas.
Yes. Now, from respiratory medicine, actually last year we had 2 questions from critical care, but only 1 question from pure or core respiratory medicine theory. But here we have around 6 or 7 questions that has come in respiratory medicine and critical care part. If you look at the questions, there were no real surprises because these are the areas from which the questions are being repeatedly asked over and over. But this is again what is Rahul sir has been talking. There are core areas which we all know from where the questions are going to come, but the questions may be at different strata of difficulty. That could be very superficial, which you can even answer without reading in depth. And there could be a very difficult question with confusing options also, like what is in allergic bronchopulmonary aspergillosis questions. 2 options were very close, and that even that's the framing of that options, the sentence of the options might even determine what the correct answer is. So the core areas always remain important, and you should be thorough with and should be able to answer the questions which are coming under any difficulty. Now, that was in brief regarding the individual subspecialties, and we have tried to highlight from where the questions have mainly been asked from these areas. Now, with regards to question pattern. So when I asked about question pattern, they had got the feedback that there were mainly 3 types of questions. One, of course, is the clinical scenario based. So whenever a student goes for the exam, they will ask us whether this exam is going to be a one-liner based or this is predominantly a clinical scenario based. And Rahul sir always say you should anticipate a mixture of both at varying proportions. Sometimes it could be one-liner heavy like the last year, or we could have a significant share of clinical scenario based questions as well. So this paper, I think, had a good mix of clinical scenario based, image based, and one-liner questions along with these true or false statements like question. So from our assessment of the questions, we had around 50 to 60 questions which were clinical scenario based, around 20 questions were image based, and 75 questions were one-liner or true or false statements. So what is your take on this pattern, sir? Is it good for the students, or can we expect this in the coming years also?
Karthik, first thing I want to tell is, after seeing the recall of all these questions, and if you compare with previous year, okay, let's compare with previous year. I think the difficulty level of this paper is definitely more than the previous paper. That is point number 1. If you compare, even last year also there were tough questions, but overall, what I understand now is difficulty level is on the higher side compared to previous. Because the problem is some of the questions that were tough were, difficult for everyone. Okay, so there were difficult questions on a higher plane as well. So compared to last year, slightly more tough. Now coming to this scenario base, so what Dr. Karthik means by one-liners is like the question might be based on a single point. It might be based on a single point, and they might have actually made it into 3-4 lines, but eventually it's based on a single line. Okay, cuticular telangiectasias are seen in SLE. So that is a one-liner point. So I think, this again shows that there are several questions you need to learn from a factual point of view. At the same time, there are clinical scenario questions as well. For that, you need to practice. So again, the same message as always, prepare for both. That's all what I can say. And that's what this mixed pattern is actually showing us also.
Yes, sir. The clinical scenario based question if you really take a dig into these clinical scenario questions, I think almost say 40 to 50% of these clinical scenario based questions were based on a single point, or we can say that that is an extended one liner, rather than you need all that clinical information to make the diagnosis or decide on management. Those were actually less. So some of the clinical scenarios were actually extrapolated one liners. So if you strictly exclude those, you would get around 20 to 30 pure clinical scenario based questions, where you will have to take into account each of the given details to reach your final diagnosis. So in an NB based entrance exam, it again shows that one liners still holds a very important place. Your memory, how you can recollect, because so many factual, not factual, but what to say, specific signs and certain adverse effects that we have seen. So certain specific one-liner questions that we usually learn for NEET PG is actually needed for NEET SS, which is conducted by NB also. So this has not gone out of fashion. You should really prepare for a one-liner and factual based question also. And along with that, as Sir told, there should be a right mix of clinical scenario based questions as well. Now, what about the questions from Harrison? This was actually a very difficult task to identify, because we have around 150 questions with us, and the Harrison, even for one topic, that data is spread over so many chapters. So, but from whatever rapid assessment I could do, around 80 to 90 questions were direct pick from Harrison. But by telling that this is a direct pick from Harrison, it doesn't mean that all these questions are straightforward and easy. Some of these questions, like the straight back syndrome or the cardiac sarcoidosis, I've mentioned, even though they are mentioned in Harrison, but the students are liable to miss those points on first or even the second reading. So that makes a proportion of even these 90 questions, some questions even from these 90 straight picks, very difficult, because these are questions which may not seem important for you and on first reading. So you could get it wrong.
So I think, Karthik, I always believe, when you read Harrison, when you read multiple times, you get more information. It is such a book. And I think, one point I want to tell everyone is, there are many candidates who have gone through all the topics once. For them, the paper was more difficult. Some of them who went through it twice or thrice slightly felt, okay, I got this point in the second reading or third reading. So I think repeated reading and revision, that is also important, is my suggestion. Do not think that a single reading through Harrison would suffice. Please try to revise it multiple times.
Yeah. So 90 questions, you had the answer directly written in that Harrison book itself. And the remaining 30 questions, so that 30 questions, even though that exact answer was not given in Harrison, but there is enough information given in that module with which you can exclude other options, or you can confirm that that is the right answer. So again, you can say that these 120 out of 150 questions, you could answer correctly if you had read Harrison thoroughly and has not missed even a single point from it. Now,
which is in fact not very easy, correct?
Yeah, definitely.
Which is in fact not very easy. So first of all, I want to tell all the candidates, who are listening to this as well. Obviously, some of you will be disappointed seeing that, there are some questions which were very tough, but please understand, once the exam is tough, it is tough for everyone. And so the number of students who get the higher percentage of scores, will come down as well, right?
Yeah. Now the final, those questions which were not from Harrison. So around 20 to 25% of questions were not from Harrison, but that doesn't mean that those questions were really difficult. For example, this condition where you don't need to do a kidney biopsy in a patient with diabetes and CKD, even though it is not directly mentioned in Harrison, but from your clinical experience and from what you have read from your guidelines and from the WhatsApp group discussions, it might appear to be an easy question for you. So again, I want to emphasize the point is that whatever questions that came directly from Harrison are not all easy questions, and all questions that were not from Harrison were not difficult ones either. So that's actually a mix of questions. And again, that underscores the fact that you need to prepare from Harrison. Harrison should be the basic book that you should refer, but you should go a little bit beyond that by solving the Q banks, reading the appropriate guidelines and the recent articles as well.
Yeah, and Karthik, just one more point to add. If there is any future aspirant listening to us, suppose if you are short of time, at least go through Harrison twice. Okay, if you're short of time, because the ideal scenario is you read Harrison thoroughly, you practice MCQs, you read some important topics from specialty. But if there is anyone listening, sir, what to study for getting a decent rank, Harrison, you go through it repeatedly so that you are likely to answer questions which majority of people will get right. Obviously, the very tough questions, but the number of candidates who get that right will be relatively less. Yeah.
So the final question of the day, so many students have asked us. So what do you think, sir, is a good score for this? By good score means probably rank below 100 or something.
So I'm talking of good score. So first of all, good score, can be anything. To get a rank of 100, you need a good score 1000. But I think the top performing candidates, listen to me, the top performing candidates, I think, they might get scores between, say, 115 to 120, 125, those who are, performing well. There can be outliers as well. Somebody can come and score 130 correct. I'm not saying after detecting negatives. Out of 150, 115 to 125, a very good student can get it right. That's what I think. At the same time, there may be a few students who get right, but I think to get a rank, in a safe zone, less than say 500 or so, I think personally, because this is too early to say, we are just one day after the exam. So I think, 105 plus correct answers you have to get is what I feel. Yeah, that is my initial assessment, Karthik.
Yeah. Last year also, the first rank has scored almost 136 or 137 questions correct. But again, as Sir told, he was an outlier. And the top 50 candidates had scores around 120, 122, 123, where the marks for those who had secured rank, I think, less than 50 or 100 last year also. So
overall, what is your assessment compared to previous, like when you compare with the last year, what do you think about the level of questions?
Yeah, compared to last year, I think the proportion of easy questions, I think the proportion of very tough questions were almost similar in this year and last year. But the proportion of easy questions are a little bit on the lower side this year. Last year had, say up to 60% were easy, where now we have 40 to 50% which is easy, and you have more number of moderate difficulty level questions. I think that is the one which is going to determine the ranks. Those questions where students have eliminated 2 options and are left with 2 options. So how many of them they have got correct, that will eventually decide their rank. That's what I think, sir.
Yeah, correct. And I think, as they say, recalls, are sometimes not very perfect, because sometimes what can happen is based on certain wordings of the question. So we have also answered to many of the questions in the group. And obviously, there are a few controversial questions as well. For that also, we need to get the exact wordings right. But again, I hope candidates who have prepared sincerely, I hope, you got above 100 questions correct. Okay, above 100 questions correct is what I hope for. Okay, right.
Yes, sir. Just like Sir has told, I think doing this recall session and analysis video session is like doing exit polls after elections. You may get the trend where it is going, but you cannot get it precise or cannot get it 100% accurate under no circumstances. So you will get a trend, you will get an idea regarding what's going to happen. And that is all what we are aiming for also. For this year's students who have just appeared for the exam, and for the future students who will get a in-depth paper analysis as well. That's what the aim of the session was for.
Yeah, and I think, for students, you just look at the last year scores of the candidates. Definitely this year it will be slightly on the lower side. That is the main message. I think most of the messages, Dr. Karthik, you might have also got, that I got in my inbox was also regarding, see, sir, how was the paper compared to last time and what will happen to the scores? I think compared to, for me, if I look at this paper, a very important point that Karthik said, many questions on that moderate range and all. So, for a candidate, a particular question might look tough, but there are many candidates who read Harrison line by line. They go for Harrison again, and again. So they might get questions like that osteoarthritis wala question is a direct question for them. So for them, it might even be an easy question. For another person who has not read Harrison carefully like that, it might be a very difficult question. So it is all about perspective. We cannot make definite statements. Obviously, we agree that we are also not judges to pass definite comments about an exam. It's just to guide you and say our perspective. Both of us, we have not given the exam, but based on what all the candidates message does, based on their reaction from candidates who prepared well, those who did not get prepared well. So based on their comments, it is like, that is what we actually try to present here. It's not just our individual assessment alone, because only a candidate who has sat in the exam hall and under that pressure gave the exam will exactly know what the exam was like. Right.
That is the perfect summary for this session, sir. I think for all the students who are attending here, those who have not joined our Doctor Tutorials WhatsApp group discussions, you can scan this QR code and can gain access to the WhatsApp group. And this is my WhatsApp number as well. You can directly connect with me regarding any queries or any advices regarding the preparation. So we will be moving on with
we'll be, like this year also, one thing we had done is all the faculties, we were active in the WhatsApp group. So I think, when we were asking them questions in the WhatsApp group. So I think such a group also will help, is my personal view. It should not affect your systematic way of preparation. But once, you just go through the questions, some MCQs that we post in the group, that will also help you. So there is anyone listening to us preparing for the upcoming NEET SS or INISS, you can join the group and stay a part of the discussions. Okay, right.
So I think that's all from our side. So
Let
can
me
we
just see if there are any important questions in the group. So somebody is asking how to watch other recall videos. Already, I think we have got endocrinology and infectious disease we have done. The remaining, we are in the process of collecting, and we'll be doing it very soon as well. And I can see some students are very frustrated after the exam. I can totally understand, I am with you on that, because once you write such an exam, if you have not prepared well, you are out of sorts. So that is quite understandable, but life is like that. Okay, but do not worry, there are a lot of seats available. Just keep calm, relaxed. Our prayers are also with you. And, let's see, let's wait for the actual exam results. But this is what I have to tell. Let me just see if there are any queries. Yeah, and just one thing, Karthik, I want to tell all those who gave the NEET SS, please do prepare for INI. There is a golden chance in front of you. You are prepared so far. Even if you think you have done well, I still believe you should go for INI. There is a realistic chance you get a good rank, because by the time the rank counseling comes, you will join INI. So I think you have to attend INI, everyone. And we are also starting the academic discussions for INI also very soon. And Karthik, I think personally, if you look at, as a platform, I think one important decision that all of us took last year was the introduction of certain revision videos, because many students are commenting in the chat box also, like the portions are so vast. So we had done specifically the revision videos, because there are candidates who are doing their residency. So during that time, they don't have time to watch all the main videos. So there are revision videos available. Number two, Harrison's, very important. So sessions based on Harrison's tables and flowcharts we had done.
So one more thing I forgot to mention is that out of these 90 questions that has come from Harrison, or more than 30 or 35 questions were directly picked from Harrison tables. Yeah. That all of that were covered in the Harrison table discussion from our platform.
Exactly. And I think, that's why we went ahead with the Harrison's tables and flowchart videos. And then we had the test and discussion videos, the elite test and discussion videos, where it's an exam followed by discussion. So I think the idea to separately segregate those videos, and so that if I am a candidate, I just want T&D videos, you can focus more on that, or QRP revision videos focus more on that. Harrison tables and flowcharts videos focus more on that. I think it all depends on how you want to shape up your preparation. That is my suggestion. Okay, so, and if there is anyone who is totally disappointed or devastated after the exam, let me personally tell you that I know many candidates who have fared very badly in a particular exam, and the upcoming INI or the the NEET SSL, they've got wonderful ranks as well. So don't just think that one exam decides how good a doctor you are. Yes, it might have gone bad for certain candidates, but please stay focused and study well and come back. Karthik, any last minute closing statements from your side?
Yeah, again, I want to emphasize that the NEET SS getting delayed could be a blessing in disguise for you, because you are already fresh from what you have learned in medicine. And I've emphasized yesterday also, often the rank deciding factor is how well you perform the medicine questions, because many of you might have already had a stronger base on your specialty of choice, and this presents before you a very great opportunity, because just around 20 days to go for the exam, you can just focus on the subject itself and just revise medicine on the last 2 or 3 days. Again, echoing sir's thought, all of you should give INI a go. That's what I think. And we'll be starting the discussions from tomorrow onwards also itself in our WhatsApp groups.
Okay, bye. Okay, then bye-bye everyone. Thank you and good night.
Good night.